No. And remember, I got 10, 15, 20 years ago, the government came out with this food pyramid where whole grains were like 10, 12, I don't forget how many servings of whole grains they were suggesting. Right. But it was that they were making us think that it was healthy, that you should be living on this stuff. Mm-hmm. But now as we're getting smarter and other minds like Dr. Perlmutter, Dr. Lustig are letting us know that was a big mistake. Welcome to the Dr. Gil Show. This is where we talk about medical matters that matter to you. My guest today is Dr. Elizabeth Wilson. Welcome to the show, Elizabeth.
Thank you, Gil.
Elizabeth is a board-certified OBGYN physician. She's a colleague of mine, a friend of mine, and she has a very ever-broadening spectrum of practice. She still delivers babies. She still does office GYN work. She's very popular. It takes a long time to get in to see her if you're so lucky to do so. And she has an ever-expanding practice revolving around women's health, wellness, and metabolism. Elizabeth and I just spent about an hour or so talking about the various blood tests that she gets to evaluate a woman's or a person's overall health, what she calls the root causes of illness. And we're going to revisit these various tests and talk about what do we actually do about the results, or what do you do about the results, Elizabeth? As a fertility doctor, I will sometimes deal with a couple of these issues, but I wanted to get your experience on this broad variety of tests that can be done to optimize a person's health. So we had started out with thyroid tests, and you can get a very expansive panel of thyroid tests looking at someone's thyroid. And let's say a woman is found to have what we call hypothyroidism. Well, how do you treat hypothyroidism in general?
Well, that's a little more straightforward than probably everything else. And when someone's hypothyroid, we often prescribe thyroid medication or thyroid replacement. And as we talked about in the earlier episode, since learning about the metabolism of thyroid and having the two types of thyroid, I probably prefer if someone's starting new, I start them on something like NP thyroid, Nature Throid, or Armour thyroid, depending on what's cheaper or what their insurance will cover.
So these are thyroid hormones that come from animal sources. I think they're beef or pork. They actually grind up their thyroid glands, powder them, purify them, test them. I actually ask them to see how much is in there, and then they blend them in a certain way that's reproducible and quantifiably measurable and accurate.
And then a lot of people are already on a medication called Synthroid, which is just the T4. And if they're doing well, I don't necessarily change anything. Interestingly, just an aside, the ground up beef and pork, I have that crazy alpha-gal syndrome where I'm allergic to mammal meat, and I can't take my NP thyroid because I started having a little reaction from that, which was very frustrating.
Did you have a tick bite?
So, well, I've had lots of tick bites in my life.
Okay, so the answer is yes.
We have a farm. My husband has way more tick bites than I do. So he and the dogs probably bring them home to me, and I've definitely had my share. So that was, about a year and a half ago, I was diagnosed with that. But that's a whole other thing.
Another thing.
I have to take Synthroid. So then Synthroid is fine.
So you prefer to start on a Nature or an Armour thyroid. Other doctors might start with a Synthroid, but that's just your preference. That seems to work for you and your patients. And these natural, let's call it natural or animal-derived forms, have the T4 in them, but they also have the active T3, which in your experience may be of benefit.
Yeah, and I've had a few cases where I've been going up and up and up on the Synthroid with really larger and larger doses, and I just can't get that TSH to kind of come in that ideal range. And then if we add a little Nature Throid or a little T3 in there, sometimes then things suddenly look look normal. But a lot of it is actually talking to the patient, seeing how they feel, seeing what their complaints are. I'll often, because, thyroid is, like we said, there's sort of a range. Like sometimes you could make a case to start a medication, but maybe you don't have to start a medication.
Right.
So I try to encourage them to do some research, learn about thyroid antibodies, the root cause of thyroid antibodies, gut health, possibly gluten, and discuss with them what they would maybe even like to try. I guess I probably see more and more patients maybe that want or that are already on a Synthroid, but they've already read about the alternative forms of thyroid medication. And so sometimes they're surprised when I'm really willing to try the different preparation.
And so how a patient is feeling is a part of your assessment.
Yes.
You listen to the patient.
Yes. And, and again, there's probably different theories and approaches. I have one patient, for an example, who, she had another doctor managing her thyroid, and her TSH was always running really very low. And kind of from my functional medicine training, I was more inclined to keep things in normal ranges and not really suppress that TSH.
Okay.
And we kind of went around about it, and I didn't want to, and this was actually a regular internal medicine doctor in town who was giving her a lot of thyroid medication. And I mean, she felt fine. She felt better. Over the years, her needs went up and up and up. And so her TSH was really suppressed. And she ended up bringing me a bunch of articles on experts. I can't remember if they were naturopaths or just researchers maybe that were discussing the suppressed TSH and what it meant. And their point was that really, if you're suppressing the TSH because you need more thyroid, that's not really a problem because you're making that patient feel better, and we don't see the same medical problems. But I took several steps back and I said, okay, but you keep needing more and more thyroid. Like, what's the root cause of your thyroid malfunction? Like, because I believe this person had potentially a lot of, post-traumatic stress from childhood, gut issues. I mean, I think they're from a root cause medicine approach. Again, some of the doctors that I've learned from, and a functional medicine doctor might actually try harder to make their thyroid work normal by doing a cortisol curve, and to help them address like some cortisol and thyroid issues to see if, addressing some of or doing stool testing and seeing what digestive issues are going around. I honestly don't remember if she had thyroid antibodies or not, but you can focus in on one thing and you can focus in on that, but you can also say, well, what other things can we do and what other things can we look at? And so I think I may have convinced her to go ahead and see a functional medicine doctor to get another opinion, because it was at the point where I never had really run anybody with the TSH that low. But she did present me with good information that some doctors think that's okay. So there's lots of different philosophies and theories out there. But I was encouraging her to look for other options. That may be a little too much
No,
detail.
I like that. I think it's okay to say that there are differences of opinion. This is an evolving field, and how a person is feeling matters, right? Now, the signs of being overthyroid, you've got palpitations, sweaty skin, weight loss, and whatnot. And certain people with a heart condition or other lethal things that can get pushed over the edge, I mean, maybe that's life-threatening. But I think most of the time you have what's called a therapeutic index. You've got a window that you can play with without having serious side effects.
Right. And so, and I'm probably more comfortable trying to stay in those windows to a degree, but it just, there's just a lot of different ways of doing things.
Sure. I'm that same way with hormones. I don't give high doses of testosterone. It's not my expertise. I'm pretty happy if someone's in a normal range, but I know there's people that give hormone replacement that you have some experience with that are more comfortable going up into the higher ranges. You've got experience with that and whatnot, and that's fine. So, another thing to drive home is be treated by a doctor or a health practitioner with some experience. and some intelligence.
And somebody that I think, I try to provide patients with pros and cons or evidence on both sides of things. Like, this may be good because of what these people say over here, but these people over here say it may be wrong because of this. And so, obviously you're not going to do anything that you're not comfortable with or anything that I don't feel safe. And I think I maybe have just had a handful of experiences where people told me that they were over medicated on thyroid, or somebody had them, and maybe that's in the back of my head. And so I'm reluctant to really push that a lot. But
right.
But yeah,
in my world, the only way you can be really over medicated is if we're giving T3 or Cytomel, or the active thyroid hormone. Sometimes I've had to resort to that because I've been pushing the T4 up real high, the thyroxine. They're just not getting better. We're not getting the results we want. I add some T3, and sometimes I'm more successful with that. But you can get into trouble with T3. Okay. Very interesting. So you can get a thyroid panel and look at various things that might be a little more involved than maybe your internist or endocrinologist might test. Another thing in the panel of things that you look at, Elizabeth, are tests on and about and around blood sugar. There's a test, an average. You see this a lot on TV, on commercials, lowering your hemoglobin A1C. A1C gives us, in part, an idea of the average blood sugar levels you have. And people who are diabetic have higher levels, and you generally want to bring them down. So tell me a little bit about hemoglobin A1C, Elizabeth. What do you do with a level that, and certainly one that's elevated?
This may be the lab that really opened the door for me on understanding the progression of health, and ideal levels versus normal levels. And so I'd say I am to a point now where I recognize borderline diabetes as crisis mode, or that's something that you really want to fix that if you can. You don't want to keep going. Yes.
You say, it's just borderline. No, this is serious business.
Right. And so probably a lot of people have heard of the book Grain Brain by David Perlmutter. He's a functional medicine doctor who's a neurologist. And that book described how between the levels of 5.2 and 5.7 is the cutoff, or when someone starts to be pre-diabetic. Okay. But that for the 5/10 of the every 5/10 or of the range there that you increase, you're increasing your risk of dementia. That it's affecting potentially, the more sugar, sugar, we talked about that being glycation. Sugar is sticking to proteins, and it kind of correlates with more inflammation in the body. It's, harder for your body to function, harder for the mitochondria to function. So that little bit of inflammation could possibly be, somehow related to inflammation in the brain and the root cause of dementia. So, and a lot of what, talking to heart disease and lipid profiles, a lot of the experts that I listen to will say, lots of people with heart attacks, they have a normal cholesterol, but they have borderline diabetes.
Yes.
And so to me, that it really, again, it reflects the inflammation component of what's going on in the blood vessels and with your proteins. And so that's something that seems like it should be very easy for us to take control of. And the sooner people realize it and understand it. I mean, I remember reading Dr. Perlmutter's book, and just suddenly I was looking at crackers differently. It was wow, this really in the end could hurt my brain. I mean, I still eat crackers, don't get me wrong, but
maybe not as many.
It made me really, really mindful about how everything is. I feel like everything is either going to put you, in a better place or possibly a worse place. And I probably think about that maybe more than I should. But
no. And remember, I got 10, 15, 20 years ago, the government came out with this food pyramid where whole grains were 10, 12. I don't forget how many servings of whole grains they were suggesting. Right. But it was just that they were making us think that it was healthy, that you should be living on this stuff. But now as we're getting smarter and other minds like Dr. Perlmutter, Dr. Lustig are letting us know that was a big mistake.
Yeah, and like a mistake on many levels.
Many levels.
Not only, because I guess the big point of what they were doing was removing fat from our food.
Right.
And so then it's like, well, that doesn't taste good. So what are we going to put back in it? Well, let's put some sugar back in it. Right. And then let's add some other kinds of sugars that like are even more easily processed. And so hemoglobin A1C is something that I just try to introduce to patients what the ideal blood sugar level might be. And, you don't have to like focus in on one level one time, but it's something to maybe keep an eye on year after year after year. And if you're floating up towards that borderline diabetes, maybe you want to try to watch things that might raise your sugar more.
Right.
So, and again, someone who I think writes really well about sugar is Dr. Jason Fung.
Okay.
And he is a nephrologist from Canada, I believe. So he took care of end-stage renal failure patients with diabetes that would have renal failure. And he writes a lot about this science of blood sugar and insulin. And he just always comes back to the sugar. But his book, The Cancer Code, is again like how Casey Means says, these are all tied together. All these problems, what you're going to the oncologist for is not necessarily different from what you're going to the endocrinologist for.
Right.
He describes how at one point we thought as soon as we learned the genetic code, we'd understand cancer because cancer has to do with mutations in the cells. Or if we knew the genes of cancer, we may have talked about this a little bit at the first episode about like what turns genes on and off at a certain point in time. But he talks about like cells being in growth mode or working mode. I mean, and obviously our cells do have to grow, but we have to be able to turn them on and turn them off.
Right.
And when you study the metabolism of growth, you understand that sugar makes it very easy for cells to just grow uncontrollably without any real purpose. And so I that was a really mind-blowing book. And he talks about insulin also being a signal for cells to grow. And, I've just, of course, in my field, I think about the estrogen receptor a lot and how it relates to cancer and making cells grow. But when you understand that, breast cancer is actually an insulin-sensitive cancer as well.
Yes.
You kind of start to say, well, what have I been focusing on the whole time?
Right.
And so anyway, anything by Dr. Fung. And I think he's written some books that are patient-oriented on, he's a real big proponent of fasting. And he wrote or maybe helped write a book. It's either Fast, Feast, Repeat or Delay, Don't Deny. But I've had those books recommended to me by patients. And he throughout all of his books, he's just saying it's the sugar. Our bodies are stuffed with sugar. And the only way to get the sugar out is to not put the sugar in.
Well, that's powerful. Now, I know one size doesn't fit all, but let's talk about how we can lower hemoglobin A1C. Obviously, if it's really high, it's up in the 6s, 7s. We've seen them up in the 12s. People horribly out of control, diabetes out of control for years. Hate to see their blood vessels, they're all cooked and glycated and inflamed and blocked and whatnot. But let's say someone comes in, it's in the low 6s, it's early diabetes. Let's talk about what we can do before we drug it, before we were supposed. And in fact, there's standards of care. If someone comes in with frankly diabetic hemoglobin A1C above 6.2 or whatever, standard of care is to start some metformin. You better have a reason not to start metformin if someone's going to review your chart or whatnot.
And metformin may be one of those drugs that so that actually, it's taken me a while to get this down. That works on the enzyme AMP kinase.
A little bit, yet the mechanism of metformin has been controversial and somewhat mysterious.
It sounds like if you've got a cell you're wanting it to function better. And that's kind of what metabolic health is. Like, how do you give the cell energy and make the cell work and grow when it needs to and not grow when it doesn't need to? That AMP kinase is something that like increases mitochondria, allows that sugar to be like, it allows that energy to be produced in a good way. And I know it's been studied like with the people that are studying longevity. Metformin is thought to maybe be I think it does keep your cells healthy. And I sat down for a weekend seminar all on, or Dr. Fung was one of the speakers. And then have you heard of Virta Health? I think Dr. Stephen Finney. And
Steve Finney. I know Steve Finney. Yeah, great guy.
Okay, so I sat at my computer.
Carb restriction and exercise physiology is his strength.
So, he was talking about this was probably people with diabetes and trying to reverse diabetes. And so he's a proponent of not just any old keto diet, but the well-formulated ketogenic diet. And so, and that's like a very specific amount of carbohydrates, proteins, and fats. And with this study and the patients that they were doing, they were doing their breath to make sure they were in ketosis the entire time.
Right.
So this is like where they're training their cells not to even function on sugar anymore, but to function with ketone bodies. So you kind of skip glycolysis, I guess, and just go right to the mitochondria. And I think it helps improve your mitochondria. And the other thing is he had health coaches that checked with these patients every day to stay on this diet that's so well formulated to try and reverse insulin levels. And they kept track of a lot of inflammation markers, A1C, weight, obviously. And I think this was a study for 2 years. It might have been a year, but it sounded just really intense and difficult. And this is where Mark Hyman's quote on "we need less doctors and more health coaches." It's like, you really need people to, come up with a plan and hold people's hands along the way.
Yeah,
because
the help and the consistency is so important.
Another woman who was part of the Virta Health, Sarah Hallberg, unfortunately, she passed away to a crazy lung cancer, young, healthy woman, athlete. But she has a TED Talk on reversing type 2 diabetes. And it's on my letter that I send to people, because if people have a borderline, if they're borderline diabetic, if they hit that 5.7, I highlight that YouTube to explain how people can turn around diabetes. And so if at the very early of being pre-diabetic, or that you're approaching, you maybe don't have to work quite as hard, but if you understand the concepts, being able to turn that cellular machinery around so that your cells are functioning better again, that'll help everything. Everything.
Right. So you get this hemoglobin A1C, and even if it's borderline high, stuff can be done about it. You consider lowering the carbohydrates in your diet. You consider eating fewer meals. I mean, some people do better, and maybe this is anecdotal. It seems to me that guys do quite well with intermittent fasting, and women can get all shaky and out of sorts and don't tolerate it as well. I guess that's a good question for you. Do you see that some people can tolerate intermittent fasting better than others?
Yes, but another person, I know I'm mentioning all these people's names, but another book that I recommend, or program that I recommend, is the Galveston diet, which was actually for menopausal women.
Who wrote that? Do you recall?
Dr. Mary Claire Haver. She's on Instagram. She's an influencer. And I've had several people give me good feedback on her system. I think her book is very straightforward, and she's a big proponent of actually not so much, intermittent fasting or time-restricted eating. Just that the idea that we're not bombarding our bodies constantly with, trying to make energy, that they need a little time. Our cells need time to kind of rest, recharge, get rid of old dead mitochondria, maybe get rid of some dead cells.
Get rid of some cells.
And that rest is probably really important to how our cells function. And so now, if somebody has a hard time with it to begin with, they may not be very metabolically metabolically flexible. So,
Yes.
if someone is very used to eating a lot of sugar and or if if their cells aren't very healthy and they kind of have battered mitochondria and they're not really great at energy producing, they're going to feel bad when they start fasting. But fasting will stress those cells and have them produce more mitochondria, and their cells will likely become more efficient if they can put up with it.
So there's a time of adaptation.
Yes.
Right.
Right.
And apparently, even in healthy men, they did these in army soldiers in the Arctic many decades ago. It took them about 2 weeks to adapt to the Eskimo pemmican high-fat diet. It's like 2 weeks, and that's in healthy people.
Well, see, and I wonder if men have an advantage just having more muscle in general, and they kind of have more mitochondria because they have more muscle. Muscle's probably a high mitochondrial dense kind of tissue, and so that may explain why maybe they adapt a little better. But
yes, so people may not take to this right away, and some people just may do better on one diet or the other.
So in Dr. Haver's book, one of the good things about the Galveston diet is it's not like, okay, you're going to start this tomorrow and you're going to eat this way. Okay. She basically just kind of introduces ideas, and with the time restricted eating, she's like, you know what? This time just stop eating an hour earlier and maybe don't eat until an hour later. And so she kind of like has you slowly move that until really you're just eating maybe during an 8-hour window, say from 12 to 8. Or, some people say that might be better in the morning, but it could, whatever fits your schedule may work. And everybody's different. You're right. It may not be for everybody, but if you think about what the disease diabetes is, we're overfed. It's simply or type 2 diabetes, obviously.
Right.
That we need to take a break from feeding somehow.
Right.
That makes sense.
Makes a lot of sense. I'd never heard of this Galveston diet, so I continue to learn from you every few minutes, Elizabeth. And I'm just going to use this to unpack this a little bit more. There is 0 dietary requirements for carbohydrate. If you look at the various organizations that make dietary recommendations and whatnot, they talk about sugar as if it's and carbohydrates as if it's a necessary ingredient in your diet. And what they confuse conveniently is blood sugar with dietary carbohydrates. Yes, you need a certain amount of sugar to function. Your body can make it. So they kind of move the goalposts here and confuse the issue. I also want to say that there's been no culture in history that's ever been vegan. You must get vitamin B12. Every culture that I'm aware of has always consumed animal protein of some sort or the other. Cultures that have said they're pure vegan, in fact, have bugs in their grains and whatnot, and get their vitamin B12 through bugs and whatnot. Mm-hmm. And I'm certainly very sympathetic to ethical concerns and whatnot, and I respect that completely. But when it comes to diet, I have said that one size does not fit all. Some people, either through their genetics or their heritage or their body type or metabolic inflexibility or damage they've experienced over the years, might take to one diet or another. And I have a lot of patients who've had their gallbladders taken out, and now they can't eat as much of one thing or another. There's certain foods that upset their stomach and whatnot. But altogether, there are some basic patterns here. And although one size may not fit all, there's general patterns that seem to be effective, that seem to lower hemoglobin A1Cs. And there's something at least we can aim for, perhaps.
I think it is more challenging if you're vegan or a culture that doesn't eat a lot of meat and you're stuck with high blood sugar or worse yet, a high insulin, which often accompanies high blood sugar, but not always. But because it's like once your body gets to that state, reversing it, if you're not going to use the new, drugs that are out there, it does call for, eating a diet with even less carbohydrates. And that can be hard if you're not eating meat.
Right. And lean meat, you can't live on lean meat. There's something called rabbit fever. If you eat super lean meat, it leads to all kinds of metabolic issues, liver damage.
And the sources of protein, which are good, I guess lentils and beans, but you have to eat a lot of that to get the protein, and then that tends to be more carbs than Dr. Finney would find acceptable in the well-formulated
and Dr. Grundy wouldn't like the lectins in there. And whatnot. Very smart people that bring up these different aspects.
Right.
So let's kind of put an end to this thing about hemoglobin A1C. So if it's coming up, in general, lowering carbohydrates, in general, perhaps increasing your exercise, and if it's higher, then perhaps adding one of these new medications or an old medicine such as metformin would appear appropriate.
Correct.
And I'm going to get to motivation at the end. Like, how do you do this consistently? Like so many people yo-yo. I know I yo-yo. I have good days and bad days. I know it's bad times before the holidays, before Christmas, and all the sweet treats come pouring into my world. It's a lot harder to stay motivated than after January 1st.
Mm-hmm. Well, and I guess that's sort of the art of like helping people find what motivates them. I know like functional medicine doctors talk about, well, what is your why? You know, what is the reason that you, and I guess you want to be healthy, you know, and I think weight and health ought to be kind of like separated, that this is about being healthy and that it's not really about losing weight necessarily, but getting you to a health, or I guess that's sort of the approach that I kind of take, that I don't really care what you weigh. I really want to help you be as healthy as I know that you can be. And so that's a journey, I think. And I think the other day I told somebody, you know, this is a 5-year plan. This is not like, this isn't.
Excellent. Yes, not a 5-day.
This is not like in a month or two, you're going to start eating this way and then the weight's going to come off in a couple of months and then everything's going to be wonderful. I think it's way more complicated than that. And it should be thought of as a zigzaggy journey, you know? So, I've really only been thinking this way for 3 years. So, I like I said, I don't have all the answers, but what I've learned is there's this gray space where you can start to see dysfunction in someone's labs that, you know, go along with aging, but it goes along with, you know, metabolic health, which will tend to get worse as we age because we don't have as many ways of fighting inflammation. And I think the environment takes its toll on us. And so we have to kind of understanding that we have to do better as we get older is just a thing that I think people do have to accept.
Mental health is fragile. Mental health is a gift. And I think we become less resilient as we get older. We need to take better care of ourselves. So another test that you mentioned that you get frequently is a test for something called homocysteine. And homocysteine was realized that it was recognized as a true toxin to your blood vessels, a true cause of vascular disease, heart attacks, strokes, all this kind of stuff. And it's certainly an easy test to get done. It's an accurate test for the most part. So if someone has a slightly elevated homocysteine, are there any treatments that you think of right off the bat to treat an elevated homocysteine?
Well, you think of methylation, which did we talk about the MTHFR mutation earlier?
We talked about it briefly,
in the first one, right?
And how it's controversial because it's so common,
right? And so I've had a few patients that have seen some forward-thinking psychiatrists who are very willing to check MTHFR and to start them on a methylated form of folic acid, which is called Deplin.
Deplin is one of the brand names. Yes.
So again, it's so mind-blowing. The best time I had understanding methylation, MTHFR, was listening to a podcast with Kara Fitzgerald called Younger You. I may have mentioned this on our very last episode. And she was studying biological age. So in this instance, she's looking at methyl groups and how they affect your DNA and how they turn your genes on and off.
Fascinating.
Right. The guy who does the Mind Body Green industry, I think he has a podcast. His wife suffered from a PE, and they both had elevated
pulmonary embolism. That's a blood clot going to the lungs that can kill you.
Right. So it can increase risk of clotting, which probably goes to pregnancy complications. You've got the brain and depression. You've got heart disease.
So elevated homocysteine essentially can be linked to depression. High homocysteine, poor methylation, in fact, has been proven to be associated with depression and, in fact, treatable. Deplin, I believe, if that's the name brand, is FDA approved in double-blind, placebo-controlled studies.
And I want to say I've had a patient or two say that it made a world of difference in their treatment for their psychiatric care.
Yes.
So
this is not crunchy granola, hope for the best medicine. This is actual proven medicine.
Mm-hmm.
Yes. Now, cost of these methylfolate supplements has been an issue in the past. I know because my wife buys them on Amazon. There's a lot of generic versions. You can get methylated folate along with methylated B12, along with other methylated B vitamins.
You get a methylated B complex.
Or they're already activated, ready to go. And the costs are pretty reasonable now.
Right. And so the reason we're talking about methylated vitamins is because so many of us have one, if not two mutations to a gene that helps promote methylation throughout the body and kind of helps these various processes happen. And so you can bypass that bottleneck. Like if you just shove in a bunch of folic acid or B12 that's not methylated, but you don't have the enzyme to turn it into what your body needs, there's sort of a bottleneck. And that's why the methylated version of the vitamins is thought to be more helpful. But the other thing that Kara Fitzgerald, she talked about, or she did a study using a methylating diet. And, I think beets and chicken livers were like a commonly consumed food. Yes, for high methylating foods. And leafy green vegetables, certain other colorful vegetables. I don't have the list in front of me, but she also, her conclusion, or one of her observations, I should say, was that there may be a lot to be said for getting those methylating vitamins with the food, with the colors, with the phytonutrients, because in the end, those phytonutrients probably play a role in how the methylation actually plays out in the end, that you can shove a lot of vitamins in somebody. And clearly some people need that.
And their pee lights up real nice, but did you help them?
But I can't remember what it was in her study, but that she really thought that really getting it in food, there was a lot to be said for, not just taking supplements. But
I agree with you. We evolved eating food. And I, in fact, have a commitment from Johnny Bowden, PhD, a functional foods expert. He's written a lot of books on this, and he's been a big advocate of superfoods, which tend to be natural. They tend to be colorful, tend to be something grandma would recognize. So I think there is something to be said for not taking just vitamins, but taking them in the form of foods that absorb better and have the other associated nutrients and blah, blah, blah. But at least a high homocysteine is actionable. You can take a fairly, reasonably priced supplement, and you can check it in a few months with very little cost, very little risk. So it is actionable, and certainly something worth measuring. And not only might you lower your chance of heart disease, you might improve your mood.
Yeah. How about that?
How about that? Imagine.
Everything works together.
Isn't that amazing? So let's say you have drawn in your panel a CRP, a marker of inflammation. And it's just a little bit elevated, but a little more than what you want. What are the things you can recommend, Elizabeth, to lower overall inflammation in someone who obviously doesn't have an active infection or an acute elevation in their CRP levels?
Well, there certainly are supplements that might lower inflammation, like fish oil and turmeric. But I guess at that point, that's really like giving people sources to help them think through their own lives of what things could be causing inflammation, because that could be different for every person.
Right.
So
talk about a nebulous problem.
So I refer them to, I have a podcast and a blog on high sensitivity C-reactive protein, and I encourage them to read that. Because
that you did, or someone that you respect?
No, I'm sorry.
Who does that?
Mark Hyman on the Doctor's Pharmacy has one just on inflammation.
Mark's a smart guy. And I want to talk about Mark Hyman. He was kind of in the fold. He was kind of like by the book many years ago. But I've enjoyed watching him kind of grow out of that and kind of forge his own path and start getting back to evidence-based rather than society-based recommendations. So I've grown to like Mark Hyman more and more over the years. I like where he's going. He's a smart guy, and I think he means well.
Well, and I haven't recommended it specifically, but a lot of people recommend his book, The Blood Sugar Solution. That's an old book. Probably saying the same things Jason Fung's saying.
Right.
And then again, that where Casey means levelshealth.com, there's a blog on high sensitivity C-reactive protein and all the things that can lower it. But here's the thing too that I've noticed. So if somebody has a high sensitive or an elevated high sensitivity C-reactive protein, a lot of times I'll see either elevated fasting blood sugar, a high hemoglobin A1C, or elevated triglycerides along with that. Like those are like you see these things go in a pattern. And so instead of saying, do this to lower your blood sugar and triglycerides and do this to lower your inflammation, it's like actually doing this should kind of like it all goes together. And so maybe that was something that I've kind of seen over time, is that if somebody has a complaint, usually a couple of these things are out of whack. So
there's a lot of things you can do as far as diet, exercise. I mean, it sounds like a cliche, diet and exercise, but
it sounds so cliche and so but it really comes back to that.
Yeah, and you got to realize that what's one society or at one time period was recommended as a healthy diet, in fact, was not. And what's recommended, for example, low-fat diets with processed foods is not a good idea. Low cholesterol, not a good idea. And in fact, fiber is probably overrated. I could go down the list of all things that have been recommended. Like I have people come to me all the time. I'm eating a healthy diet now, or I'm eating a clean diet right now. And then I see what they're eating, and it's like, no, not a good idea. And then when it comes down to exercise, you may not be old enough to remember, but there was this runner. He wrote a lot of books. His name was James Fix, Fixx. He was into long-distance running and marathon running for health and whatnot. And he died of a heart attack because he's doing all this endurance running, which is probably not good for your heart.
I think the guy who started Virta Health with Dr. Finney was a marathon runner who carb loaded all the time and then was shocked that he had borderline diabetes in his 30s or 40s. And I'm almost positive there's a story of that he and Dr. Finney, or maybe he saw Dr. Finney, and it's like, you can't outrun a bad diet. And to some extent, that kind of over-exercise probably in some degree for some people could really, increase the inflammation and oxidative stress, which kind of has to do with your body burning energy that, and over time, I think even though we think of that as being so healthy, that for some people can probably be harmful. Not everybody. Not everybody. You have to take the whole, you just have to take everything about someone's life into account when you're like trying to fit all these pieces together, which I mean, I am not doing on the level of like some of these other practices, but it's interesting how when you open your mind up to a little bit more and try to pull more things together, and talk to people more. A lot of these things sort of come together. But you brought up Stephen Gundry as well.
Yeah, I know a little bit about Stephen. He used to be a very, once again, by the book society cardiologist. He has branched out into diet as well, and appears to be talking in ways that I understand a little better and approve of more.
Okay. So one thing that has been a conundrum for me is, sometimes when I see that people seem to be doing well with sugar, their body handles sugar fine. They have a normal hemoglobin A1C. I'll check a fasting insulin level and it's kind of normal, but they have inflammation. And so then that's when I kind of think or jump to the second thing that Mark Hyman talks about, which is like gut health or, the microbiome, leaky gut. And that's where autoimmune disease comes in. And that's where I think Dr. Gundry's, where it gets way more complicated, that maybe people have certain food sensitivities. We know, say that gluten and dairy are huge ones. Right. That's where functional medicine gets really exciting to me, because they really do have solutions and diets and plans and ways to kind of help somebody maybe work through autoimmune illness with a little more detail.
All right. So I know very little about this, but it seems to be a something I'd like to learn more about, Elizabeth. So another target. So if you have elevated inflammation, another target is the gut. And let's both acknowledge there are greater experts on gut health and leaky gut than us. What are the things that one can do? I'll just use a personal example. If I eat pancakes for breakfast, I am a mess. I've got the brain fog. I'm bloated. I have no energy. So I know it's very easy for me to say I should not eat pancakes for breakfast. That's an easy one, right?
Yeah.
But if you've got, or like I said, people without a gallbladder, if they eat a particular food, they got to run to the bathroom because they get the runs, and they know they can't eat that particular food. But what are the approaches you would take to diet, elimination diets, or things one can? What are the things you can do first to address potential gut issues?
I speak very generally about gut health. I have some Institute of Functional Medicine handouts just about general, like, good things you can do for gut health. What are prebiotic foods? What are probiotic foods? What things tend to cause inflammation and damage? I've had a couple handouts that I've made. I may plug another practitioner in town, Carrie Ball. Carrie Ball is a licensed nutritional therapist. And so she and I used to work out together, and we would talk about nutrition on the side. And I don't think she's practicing accounting anymore. She was an accountant, but she kind of got into nutrition, and I don't think she'll mind me saying, she had her gallbladder out at some point. And so she really thinks through these issues, everything from, how you chew, how you swallow, how you digest, just like how all that can play a role. And I think she might be somebody who would actually do like stool testing, like a functional medicine doctor, to help you kind of figure out the root cause. I'm going to say, I just learned this, literally this weekend. So there's the company zoehealth.com is another company like Levels that you can do continuous glucose monitoring for. It's out of the UK. And the guy, I'm going to blank on his name, who was behind it, was the guy who was into genetics and then decided to start studying the microbiome because he thought that's where everything was happening. So part of the Zoe plan is to actually look at your microbiome as well. And he'll even say, we don't know, we're just now learning about all of this. Like, nobody
there's
really
millions of bacteria. There's
knows.
Thousands of types. I know there's clades and patterns
and so,
of this.
Right. So this isn't, I don't, leaky gut is something potentially in and of itself that, depending on how severe it is, you may need a more dramatic intervention. I can speak to what I think that is, but in general, he said, try to eat 30 different plants a week. And that includes nuts and seeds, herbs and spices.
Interesting.
Right. And because like some very basics are, the more diverse your microbiome is, the more different kinds of bugs you have, the better you are.
I like it. That's practical. That's the stuff that I like to learn and I like to share with my patients who are trying to get pregnant and might have a health issue. I try to tell them to eat lots of colors. Right? What are the various colors? I call it rabbit food when I mean salad and vegetables and whatnot. Well, there's green, there's dark green, there's purple, there's red, there's orange, yellow. I mean, people can clue in on that. So say that again. 30 different plants. So that would include nuts. That would include vegetables. That would include fruits.
Yeah, I after going to my first functional medicine conference, I started really upping the nuts and seeds and everything, and and it's tasty and it's delicious and it's wonderful. And so
they can be, the good ones can be somewhat expensive too. You
Probably.
get what you pay for because they need to be packaged properly, and so they don't go rancid. They shouldn't be exposed to oxygen, and so quality food. So 30 different plants, and it doesn't matter. And then let's go over this again. This is to diversify the bacteria in your gut, and
the more different kinds. Obviously there are some good kinds and there are some bad kinds, and
sure.
On a very simple level, it sounds like, of course, sugar and starch and the processed foods really feed the bad guys. And then those bad guys make you want more of that food. Like, it's just this vicious cycle.
It's almost an addiction that they feed themselves.
It's kind of crazy. But, in the functional medicine courses, and obviously specifically in the GI course, they have a very specific protocol for healing leaky gut. If somebody has autoimmune disease, they call it the 5R program, and I probably can't remember what it is.
Can you remember some of it?
I can remember some, but the idea is they, remove the things that are causing problems. And so that's like an elimination diet. And Whole30 is an elimination diet. There's the Virgin diet is an elimination diet. There's a guy, I'm going to blank on his name, who also, there are websites you can go to, and actually a group of friends and I, we did for a month the IFM elimination diet, where you got rid of sugar, wheat, corn, caffeine, dairy.
Oh, not caffeine.
Alcohol, canned meats. I think red meat. Is it red meat? Yeah. I think I could have, at the time I didn't have alpha-gal, and I did eat venison, like game. I could have game, but nothing that was processed.
Interesting.
Nothing in cans. So anyway, it was, and the idea was like, you just take out all the things that are possibly bad and harmful. Now, the reverse of that, or another alternative to that, may be like food sensitivity testing. Okay, that may not be proven. Different tests may give you different answers, but I think there's a lot of...
There's probably a role for that.
I remember going to a lecture at one of the chiropractors here in town who discussed like doing sensitivity testing for a patient who's eating a ton of avocados. Good, healthy fats, that's on every diet. Right. Nobody would take that away on an elimination diet.
That person lit up, huh?
And then, and this person was like facing like a surgery for, I don't remember if it was Crohn's or ulcerative colitis. And anyway, after doing the food sensitivity testing and, whatever they could do to lower inflammation, they really had improvement in their gut symptoms and didn't end up needing the resection. Right. And I don't know if that's going to obviously happen every time. And I'm not telling anybody to stop eating avocados, but the idea that we could personally have issues with different foods,
right?
Or along the lines of Dr. Gundry, that certain plants that may have a lot of lectins may be more likely to cause inflammation or issues there in the gut lining. So there's remove, replace, reinoculate, rebalance. And there's another one. Replace is the good bacteria. Sometimes, have you heard of people taking digestive enzymes?
Yes, I in fact take digestive enzymes.
Okay. And actually sometimes people take, believe it or not, more acid to help with digestion.
Yes, my chiropractor wants me to take more betaine.
Right.
Betaine,
okay.
Yeah.
So, and the irony, though, you see people that have digestive problems and then they get on these acid blockers.
Right.
So these awful drugs that further reduce the way you're digesting because it gets rid of your acid that you need to digest
can't digest
food.
as well. It seems
And then it kind of messes up your microbiome as well.
There's less digestive stuff, so all the bacteria in your colon change.
So if we would address the root cause of why they started those acid blockers in the first place, would we prevent like some of these downstream things? But acid blockers are a prescription. They're easy. You can write for it. The drug companies are happy.
Right off the bat.
Yeah. So I mean, that was just fascinating to me. That what do you mean? People need more acid to digest food? I thought, I'd been trained to block acid. So that's an issue. Rebalances the, just the whole stress piece, the cortisol piece, the idea that your brain and your gut came from the same place in embryology, connected by the vagus nerve.
And the vagus nerve, they're both connected.
And if you're not, actively trying to manage the parts of your life that are stressful, that could really work against you as well.
So as far as renew and reculture and whatnot, one recommendation we have is to give fermented foods.
Oh, yes.
You can get fermented pickles that haven't been cooked to sterility, for example. There's a particular brand we'll recommend.
That probably is right under eat 30 different plants a week, is like try to get a little bit of fermented foods every day.
It makes a lot of sense. I deal with the female reproductive tract. We've got to get the right bacteria there as well to promote fertility and health. And what have you. So ways you can get these good bacteria back into your gut. Once you've got digestion, you don't have the harmful foods in there. These include fermented foods. These include probiotic foods that have actual lactobacilli and active bacteria in them. And I've also been told, I'm not aware of any data. Maybe there is data that if you eat food, particularly from a garden or a local source, and you don't wash it too much, right? You don't necessarily peel it. You get the dirt off, the big chunks off of it. Well, there might be a role for bacteria from the environment getting back into our guts.
They talk about that our ancestors had way more diverse microbiomes and
they were dirty.
Yeah. And I think there's a lot of people in the space that think getting outside, gardening, having your hands in the dirt, having kids play in the dirt, having kids chew on dirty toys. Like, yes, there is something, and I mean, preferably you'd probably rather have those be organic foods that you're not having like as many pesticides
off of it.
But the other thing that for healing, I don't know what the R is for that, like the gut lining that's been so porous, that's allowing things to escape into our system. Right. I think functional medicine doctors call it assimilation, but there's glutamate and, bone broth, like the
Tell
bone
me about
broth
glutamate and bone broth, please.
Well, I know that glutamate is healing for the gut lining. Bone broth is also healing, but it's got to be made, it has to be true bone broth where you're actually extracting the, from the marrow, those healing components. And so
all these old recipes,
just like our grandmothers would tell us. Yes,
boil the bone. I always know that when I've got the ham with the bone in, that jelly that comes out of it is just so scrumptious. There's got to be something healing about that if my body is drawn to consuming it.
But the tough thing, and again, I'm not a functional medicine doctor and I don't do this. I encourage you to see one if you think somebody could help you with this. But it sounds like to do the healing, I think, vitamin A, vitamin C, but there's some vitamins, there's just some good things that really will heal that gut lining. But you gotta get the bad stuff out of there. You have to get it ready to heal.
Right.
It's just like, you can't just like throw these things into a bad diet and keep eating dairy and gluten and think that even though you're doing all these things, that gut lining is going to heal and the autoimmune diseases are going to go away. And which, I'm not going to say that everybody has success with this all the time, but it makes more sense than just saying, oh, I've got antibodies and autoimmune disease, I'll watch it get worse.
Right. You got to try something. Yeah, I know. I was also recommended colloidal silver and what's the green spicy leaf oregano or so
Okay.
oil, supposedly to decrease the bad bacteria. It seemed to me that I didn't get great results with it personally. Maybe I wasn't doing it right, but that's just an antibiotic apparently to kill the bad guys. But you can never eradicate them completely, and they grow so quickly. I didn't see much benefit to it, and I stopped doing it.
Do you have SIBO, small intestinal bacterial overgrowth?
Well, they were talking about that as a possibility, and that's getting out of my area of expertise.
And the thing that's so hard about it is, that just is really difficult. Like if bacteria, maybe if it's even good bacteria, can get in the wrong place, and then how do you fix that?
Right.
I mean, that's and that's where sometimes people that have done this or kind of have ways of thinking about it. I think people do have success, and it's worth checking out these.
Pursuing,
yeah,
particularly if you have bowel issues and inflammation. Mm-hmm. So it's certainly an avenue worth pursuing.
Yeah, but if I even just spark someone's interest in gut health, and the next time they read about it, they think, oh, well, this kind of does make sense, and well, it's just like these little pieces of information that you're putting out there that someday may help somebody make a better decision.
Right. And you're not going to see results immediately.
I don't think anything is that way. And that's
right.
Yeah, this is the thing that I'm learning, is that there's not just one thing in your body. It's like one thing affects everything else, or it's kind of like a spider web, and you tug on one thing and everything else kind of goes with it. And so you just have to consider so many things at one time, and it can be so overwhelming. But yeah, lowering the expectations is probably a really good start. Maybe that's the first start.
And another test to make sure we get through all these tests that you might get, and helping someone improve their metabolism, is this lipid test, is these cholesterol tests, where they look at the total amount of cholesterol, and they look at how much is light, how much is heavy, and the traditional panel they compute their extrapolated numbers that aren't truly measured, and the triglycerides. So let's say you have some abnormalities. Cholesterol total is a little high, triglycerides are high or very high, and the HDL is low. That's what we usually see in people who are overweight or eating a modern diet.
Or classically, those are two of the definitions for actual metabolic syndrome.
Metabolic syndrome.
It doesn't have to do with total cholesterol. It's with elevated triglycerides and low HDL.
So right off the bat,
okay,
when we look at a lipid panel, total cholesterol, at least to me, total cholesterol means almost nothing. Even though the computer has put a little H by it.
I'm with you. I'm with you there.
It's 201, and they put an H on it because it's over 200. I think we both agree it's virtually meaningless. So what are the other things we look at? You mentioned HDL.
Yeah. So again, this is where I kind of bring my metabolic chart in, or this is how I think about it. I don't really present this to every patient.
So can you hold that up here?
Oh, sorry. I can hold it up in front. And so, again, I try to imagine patients that there's not a diagnosis, there's not anything specific, but if someone has the diagnosis of metabolic syndrome, what do I have on here? That typically triglycerides are over 150, and for women, their HDL is less than 50.
Okay.
But over here, I went ahead and because going to all these courses, everybody talks about like what is the optimal level, what is ideal metabolic health. And so these are sort of the goals, if you will. And so, I mean, I see a lot of people that are above 100, they're not 150. But I just try to point that out, that it would be better if your triglycerides were lower. And that's, can almost always be diet driven. And usually it's a carbohydrate thing or diet quality.
Foodable. So let's just say it's right off the bat. How can you lower triglycerides? Lowering carbohydrates. Very, very simple.
Yeah, I think it's carbs, smoking, and alcohol are the things that can also be an issue.
Really? Mm-hmm. Really? Now, the other thing we look at, and I know this is an oversimplification, and people that HDL is good, LDL is bad. It's not that simple, although it's been touted that way for a long time.
Right.
But if we pretend that HDL is the good stuff, how do we raise HDL?
Oh, I think that is potentially a part of sometimes with insulin in metabolic syndrome. I think that's driven by how your liver is responding to insulin resistance. And so again, I think potentially lowering carbohydrates, lowering inflammation can help your liver manufacture the better ratio of those things.
The HDL. So I'm going to once again get on my soapbox here. How one raises HDL is with saturated fat. And people have been afraid to say that for decades now because of this fear of LDL, which turns out is probably not warranted. But how do you raise HDLs? By increasing saturated fat.
Okay, and where's that from? Or who's what guru? Okay.
From everybody.
Okay.
From everybody. Everyone acknowledges HDL goes up with saturated fat.
Dr. Lustig calls it probably neutral, I would say.
Well, but maybe in overall health.
I actually read that was one thing that saturated fat may actually help to lower lipoprotein a, my problem, that thing that I mentioned earlier.
It might, but it's very straightforward that saturated fat raises HDL.
Okay.
So it's very, very straightforward.
Okay.
Now, turns out I mentioned that LDL, it's really interesting. If you look at the studies that are quoted for recommendations on diet and lipids and whatnot, almost every time they do a study, they do a mathematical computation looking at hazard ratios or relative risks or whatnot. They always say, well, after controlling for blood pressure, after controlling for diabetes, after controlling for smoking, after controlling for homocysteine, after controlling, in which they're saying, these are the big players. These are the things that really matter.
Yeah.
Well, we can show a slight mathematical relationship with LDL. But in the design of the study, they already told you what really matters.
Yeah.
Blood pressure, smoking, diabetes, right?
Or inflammation.
Right? Inflammation, all the CRP, they always do that. Mm-hmm. So the fear of LDL has been so overblown. And unfortunately, I'm going to talk about this once again with some other experts in the future. But the reason LDL got all this attention is because that's what statins lower. Statins lower LDL, so you can say, hey, we're lowering LDL, but really statins are working through inflammation and clotting factors primarily. So
I say I've heard that too, that they probably work more through lowering inflammation than actually the lowering of the number of the cholesterol particles.
Correct. Mm-hmm. So I just wanted to say that when we're interpreting a cholesterol panel, a lipid panel, when you and I are doing so, although I'm not doing in women, in fact, the predictive value is so low, I don't even get them. Because I'm a fertility doctor and doesn't change what I do. But that you need to be able to interpret these with enlightenment and an open eye, such as you have.
Well, now just looking at that triglyceride to HDL ratio, it just makes a lot of sense that that's a really good marker of insulin resistance, metabolic health, how well your cells are functioning, how well energy is being used in your body, how well your liver is able to, direct the energy around because I guess, energy, it's your cells, it's your liver, it's your muscle, how your muscle will signal insulin resistance back as well. There's so many things going on, but I don't know. That's a pattern that I look at, and I try to get patients to look at it also.
So two more things I'd like to talk about briefly is how do we increase the amount, the action of our insulin and our ability to lower blood sugars? It's with active muscle mass. Active muscle mass. And how do you develop active muscle mass? There's a real simple way. You can lift some weights. You can lift some weights. And no one's going to put down walking. And if someone wants to walk, God bless them, all more power to them and whatnot. But something that I think is part of this equation is lifting some weights.
Resistance,
and it doesn't, some resistance training. Mm-hmm. Doesn't have to be in a gym. You don't have to injure yourself lifting heavy weights or whatnot. But there's a million things you can do with your body weight.
And I think, Gabby Lyons, I may have mentioned her before. She calls it muscle-centric medicine. Like she says, actually, we're not over fat, we're under muscled.
Yes.
And she interviewed some expert on, the guy maybe who first defined sarcopenia, which is kind of loss of muscle mass with age. And he said, we kind of were thinking that's just the way things are going to be, but maybe we really should be trying to fight it because it's so crucial to everything metabolic functioning as we age. And he talked about even with much older individuals in their 90s using resistance bands to improve muscle and increase muscle mass.
Yeah, and while we're mentioning names, I do respect Peter Attia. He's very popular. I recommend seeing his podcast, and he's just written a book on longevity and strength and how just your strength, your grip strength has one of the strongest correlations with longevity of anything out there. Can you hang? Can you squeeze something? Do you have muscle mass? And apparently if you run the math and the statistics, that is more associated with longevity than almost anything, like 5 times higher correlation than other things about how you eat and whatnot. So we can't leave out resistance training, muscle strength, and whatnot. And the final thing that's going to be somewhat controversial is sunlight. Now, there are experts on sunlight, but in just reviewing this and following one particular guy in general, his name is Jack Cruz, sunlight has been underappreciated, and unfortunately, we've had tunnel vision about sunlight due to dermatologists wanting to prevent skin cancer, and they mean well and whatnot. But if you have tunnel vision and look at skin cancer only, and you don't look at health in general and all-cause mortality,
it's like estrogen and breast cancer.
Like estrogen and breast cancer, it's just one small. You can't look at just this, but maybe so important to get out and get in the sun. What runs our adrenal glands is this hormone that comes from our pituitary, but it's in our brain, it's in our eyes, it's in our skin. It's called POMC, pro-opiomelanocorticotropin, if I'm saying it right. Well,
I'm not familiar with that one.
POMC. So in order to drive your adrenal gland, when you make this hormone, you also drive tanning. You also make endorphins, which make you feel better. I mean, we evolved in the sun, so our mood, and the alpha MSH controls in part energy partitioning and appetite and all this kind of stuff. So getting out, almost everybody, who has the means, bless them, go over the holidays, they go down to Cabo or Mexico or the Keys, or they try to get some sun, right? Because they feel better. Well, you know what? It makes you feel better.
Well, and not to bring this back to the microbiome again, so Tim Spector, he's the guy who started Zoe, I think that's his name, or the one that adds the microbiome to the continuous glucose monitoring. It's like a patient, and it just like levels, they're not only giving patients feedback, but they're kind of collecting data at the same time. So it's like an experiment that patients want to participate in because they're actually getting some feedback at the same time. But he used melanoma specifically as an example of how, we were all focused on one thing, and yet it's really an immune thing. And when you understand how much the immune system is connected to the microbiome, like there's so much going on right now about that. It just reminded me that, we kind of focus in on one thing that we know that causes something, and everything else falls away.
Yeah. So lack of sunlight, working night shifts. Oh man, this goes on and on. Circadian rhythms, and this is a topic that will never keep on giving. It'll never stop losing interest. But that's another. I just want to put another point. That's another actionable item for weight, for mood, for sleep. All this sunlight is a part of the equation. And taking
vitamin D,
right. The vitamin D, but it goes above vitamin D. Getting one's glasses off so the UVB can reach your retina and regulate all these hormones that we've evolved with. It's a very sophisticated, combined system, and it wouldn't be there if it weren't important,
Right.
if we didn't evolve with it. So there we go, Elizabeth.
Okay.
We've talked about now all the various tests you draw and some actionable things that you can recommend that our patients and our colleagues and our friends can do to address the root causes of a lot of diseases and metabolic issues. Is there anything that you'd like to put a finer point on, or anything you'd like to cover before we end this wonderful discussion?
No, we had plenty to talk about in the second hour, didn't we?
Certainly did.
Probably turned into an hour and a half.
That's fine.
Right.
Well, tell you what, Elizabeth, what a pleasure it is knowing you. It's wonderful having you here in the community as a resource. I'm going to say again, your patients love you. Some of my nurses are your patients, and they really enjoy your care and your professionalism and all that you add to their medical care.
Well, thank you. I actually, there's one thing I will say that actually Dr. Miles told me when I reached out to her about the iodine. She told me that the root word of physician was teacher.
Yes.
And it was just like, it's like I sort of feel like that's what I'm trying to become more of, is just like,
Doctor is teacher.
Teaching patients what they need to know so they can live their best lives.
Well, you've certainly taught me a lot, Elizabeth. Thank you so much for your time.
Yeah, thank you so much.